Well, hello everyone. My name is Mike Noonan, and I have a particularly easy task, and that is because if there is one person who probably does not need an introduction at this meeting, it is our next speaker. David Fraser is sometimes quite deservedly referred to as the Dean of Animal Welfare Science. It is no exaggeration to say that much of what we do today stems from the work that he and other pioneers in the field have carried out during the past half-century. And jeepers, David, I think I just made you sound really old. But it is true, starting all the way back in the 1970s and right up until the present time, David Fraser has maintained amazingly productive and especially insightful programs of research that have investigated welfare and applied animal behavior issues in both farm and animals and in wildlife. His published papers range across practical problem solving, cultural dimensions of applied animal ethics, and theoretical contributions to animal welfare science. Dr. Fraser is also a person who has been incredibly generous with his time and with his wisdom. He serves as scientific advisor to a great many organizations, including the World Organization of Animal Health, the Food and Agriculture Organization of the United Nations, and the organization that is presently hosting us today, the Detroit Zoo Center for Zoo Animal Welfare. He does this all from his position as professor in the internationally respected animal welfare program at the University of British Columbia in Vancouver. Please join me in welcoming Dr. David Fraser.
Thank you, Michael, who had promised to do a one-sentence introduction. Thank you to the Detroit team for their unique level of leadership in this area, which I've enjoyed for many years and look forward to enjoying for many more. And thank you to each and every one of you for the honor of being able to share some thoughts with you this morning. And since the best things can be said in tweets, here's my tweet for this talk. In improving animal welfare, we have paid a lot of attention to facilities and not enough attention to people. And by people in this context, I mean mainly staff and managers, although visitors, of course, can also be important. And to discuss the tweet, I brought two photographs illustrating two different models of change that emerged during the 1800s. The one on the left, we'll come to the right-hand one in a few minutes. The one on the left, of course, is a historic photograph from an old textile factory at a time when workers, many of them children and women, were working what we would consider appallingly long hours in what we would consider appalling industrial conditions, unhealthy and in many cases unsafe. This led to a reform movement growing throughout the 1800s to try to protect the welfare of workers. And as one example of the campaigning that was done, in 1833, an individual who today we would call an activist wrote, "Drowsy and exhausted, the poor creatures fall too often among the machinery, which is not in many instances sufficiently sheathed, when their muscles are lacerated, their bones broken, or their limbs torn off." The response to this kind of campaigning during the 1800s was a series of reforms throughout the industrialized countries, which in England were called the Factory Acts. And they tried to improve the welfare of workers mainly by making the factory environment safer and healthier, and by limiting the hours of exposure that people had there. So, for example, the Factory Acts in England progressed through, for instance, 1802, one required ventilation and cleaning of textile factories. 1819 set a maximum 12-hour workday for children up to 16. In 1844, dangerous machinery had to be fenced. Finally, 1878, no children under 10 could work in factories. And then by 1901, workers had to be protected from dust and fumes and have 7 cubic meters of airspace per worker in order to maintain air quality. So these developments happened almost entirely in the 1800s. By the 1900s, people began to see scenes like this in agriculture, and this in high-throughput laboratories. And people formed the distinct impression that animals were being kept in factory-like environments. It was explicit in the case of agriculture, where critics wrote about farming turning into factory farming, animals being treated as animal machines. And with this new perception, it seemed only natural that the response would be to regulate these factory environments. Much had been done for the early manufacturing factories. In fact, the parallel was so similar that in the UK, the first farm animal welfare standards were referred to by an official as a Factories Act for Animals. And they followed the old pattern so precisely. So, for example, the physical environment space allowance was an element. In 1988, hens in the United Kingdom had to have 450 square centimeters of floor space, rising in 2002 throughout the European Union to 550. And then 2012, hens had to have 750 square centimeters plus a perch, nest box, and litter. As in the Factory Act, ventilation and air quality were issues. So in 2010, broiler chickens in Europe had to have ammonia levels under 20 parts per million. And roughly paralleling limits on worker time, we see restrictions on the time in confinement. 2013, sows in the European Union can be in crates for only the first 4 weeks of pregnancy, not throughout pregnancy. And although this approach to animal welfare reform started in agriculture, I think it created a culture, a mentality where, when we want to improve animal welfare, it comes only natural to us to think about the environment in which the animals are kept and the appropriateness of that environment. But is this the best approach? Are these approaches, based on the environment and exposure time, really working to safeguard animal welfare? Well, some of them undoubtedly help. So, space allowance, amenities, climate control, of course these things are very important for animal welfare, and no one would ever suggest rolling back the standards that we now have. But when we look at some of the last 10 years of research, especially on the farm animals, we see something very interesting. It started with a study of chickens kept in these kind of open barns, and it was a study in the United Kingdom that monitored some very basic welfare outcomes. There were some behavioral ones, but the most basic being death rate, mortality rate in the flock, lameness, and the leg lesions and foot lesions that sometimes birds develop in these facilities. The study was actually a huge experiment on space allowance, because space allowance is often one of the features of animal welfare standards, and the attempt was to see what would be an appropriate space allowance to set. So it involved 114 flocks owned by 10 different companies, and each company agreed to house some flocks at each of 5 different space allowances. The results showed that space allowance did make some difference to some of the variables, but the really big differences were not between different levels of space allowance, but between different companies. The best company had a mortality rate of 1.4%. The worst company, 14%. Lameness ranged from 0% of birds lame in the best company to 90% of birds lame in the worst. Leg lesions, foot lesions, much the same. This was followed by a study of 149 flocks looking at foot lesions, 0 foot lesions in the best flock, 72% of birds with these lesions in the worst. Then 176 flock study on lameness, 0 in the best, 84% of birds lame in the worst. I'm going to One more example, coming from my other favorite species of pigs. Of course, the death rate in piglets is a major animal welfare indicator because most of these deaths happen either from starvation, injury, or suffocation. In Norway, where the law now requires this kind of open housing to be used for the lactating sow, recent study of 39 farms found that the death rate of piglets was 5% on the best farm, 24% on the worst. An older study in Canada with more restricted housing, 10 to 32%. Study of 83 organic farms in Europe, all of them using organic standards for the housing system of the farrowing and lactating sow, death rate from 0 to 50%. All right, if you were a farm audience, I would proceed to traumatize you with table after table of data, different species, different production systems, but all leading to a conclusion so simple that it too can be said in a tweet. In fact, the best science can be said in tweets. The world is round. The planets orbit the sun. E equals mc squared. So groundbreaking scientific tweets. I don't claim to be in that range, but here is my tweet for all those data. Very different welfare outcomes occur in the same physical environment. And why is this? Well, this is almost certainly because the environment is not the only factor, maybe not the most important factor for improving animal welfare, because animal welfare depends so strongly on human factors, the human dimension of animal welfare. So what is it about some people and their behavior that allows them to achieve good welfare outcomes when others don't? Well, you're all animal people, so let me ask you right now to make a mental note of what you think is the most important aspect of people and their behavior to promote animal welfare. Then I'm going to do a quick run through of what I see coming out of the literature, and in our discussion, let's see if I've missed any of the points that you've thought of. Well, I think the first thing coming out is clearly knowledge and dedication. So that chicken study, the farms with the good outcomes were ones where the people recognized the importance of hygiene and controlling humidity and managed those variables carefully. Second was consistency. The good outcomes were on flocks that were managed by 1 or 2 people, not a rotating cast of 6 or 7, and where the people visited the flock several times a day, not just once. Some of you will remember Nadia Vilibnovsky's study with the clouded leopards, which had almost exactly the same result. The low stress levels were in those leopards that were attended by only 1 or 2 workers consistently, and they spent a lot of contact time with the cats. Another, of course, is skillful handling, and the field is indebted to Paul Hemsworth, who we have the honor of having in the audience here. It's an old picture of Paul on your right with his book, Human-Livestock Interactions, on the left. And Paul has done decades of research showing how skillful or unskillful handling result in welfare outcomes. I am going to simplify his work even more than he did the other day with this simple model, showing that negative handling, or inconsistent handling, which is almost as bad, can set up a state of chronic fear of people in the animals, leading to a classic stress response when people are around, thus reducing growth, immune competence, hence affecting health, and so on. I think to this list we can also add having a positive attitude toward animals. So Paul's group has also done, in one case, used a questionnaire to identify people working with dairy cows who described them in positive terms like stimulating, entertaining, and intelligent, versus those workers who described cows in negative terms like noisy, smelly, and ugly. And he found that those who had a positive attitude toward animals handled them in a more appropriate, skillful, gentle way, leading to lower fear responses and so on through that progression. And so the selection and training of staff, both for skillful handling and for positive attitude toward animals, is an important factor in this process. To this list, I think we can also add treating animals as individuals. And my favorite study on this comes from the UK, and I'm going to put a quotation up here because I don't think you would believe me otherwise. Here was the finding of the study. On farms where cows were called by name, milk yield was 258 liters higher than on farms where this was not the case. And you know, this also works with students. So I keep my classes down to 70 because that's about the limit of my memory, so that about halfway through the term, I know everybody by name. And one young lady later confessed to me how this affected her. She said, partway through the term, she said to herself, "Good grief." Well, her wording was more colorful than that. "Good grief, he knows who I am, so I'd better not screw up." I think another thing I want to add to the list here is that the animals and the environment and the people combine together in a way that creates a culture of care in a facility that can either be good or bad. Recent study called Building Cowshed Cultures looked at this with a number of dairy farms in New Zealand. And they found that on certain farms, the design of the milking shed, the quality of the walkways, created an environment where the animals were either easy or difficult to move. This then combined with the handling skill of the people and the personality of the animals to lead to outcomes that were either good or bad. And the authors emphasized the key importance of designing systems and structures that promote positive interactions, we might add, that prevent negative interactions between animals and humans. So here we see this three-way interaction of the animals, the environment, and the people that need to be in harmony. And finally, on the list, I want to put attending to human well-being. I'm not sure how widely this applies in the zoo environment, but I want to give two examples of how profoundly it applies in society generally. The first of these being neglect, one of the major reasons for cruelty charges in developed countries. A recent study of neglect in Ireland followed 13 cases of people charged with neglect and found in 5 of the cases there was an underlying problem of age or health in the farmer that meant that they couldn't look after their animals well. Another 4 cases, there was an underlying problem of depression or other mental health, often linked to family stress, economic stress, and so on. And in only 4 of the 13 cases, the issue was, well, it was sort of an attitudinal thing. The producer didn't really care that much about animal welfare. The conclusion being that in order to solve the animal welfare problem, in most cases, we need to address the underlying problem of human health and mental health, and that animal welfare enforcement and social work need to be combined. The other problem is hoarding. Again, a major issue in animal cruelty enforcement. It's now appreciated that hoarding, whether of animals or of objects, is a distinct form of mental illness with a high correlation with other forms of mental illness. In one study, for example, people with hoarding disorder showed major depression in 57% of cases, social phobia and generalized anxiety order in 29%, and obsessive compulsive disorder in 17%. Well, neglect and and hoarding are dramatic examples of animal welfare failure. But I think the general point here is that the mental health and physical health of people has a profound influence on animal welfare. All right, I spoke about two models of change, the one on the left being the model of the regulated industry, where people tried to improve the welfare of workers in a factory by regulating the environment and exposure time. And I've argued that that was the model that was inherently adopted by people trying to do the early animal welfare reforms. But on the right, I have put the model of the professions, a development that happened during the same period, during the 1800s, and represents a completely different approach to reform. I used the photograph here of Florence Nightingale. When Florence Nightingale announced in the 1840s that she wanted to be a nurse tending to wounded soldiers, by all accounts, her family and friends were horrified. Being a nurse was an unskilled, low-status occupation seen as barely better than prostitution, and certainly not appropriate for a young lady from a prosperous family. Well, having got some experience under her belt, Florence Nightingale then founded the first School of Nursing in 1860, and by the end of the century, progressive countries were starting to recognize the registered nurse as a distinct profession. So here was a very different model of change, not trying to regulate environments, but focusing on the skill, knowledge, dedication, and performance of people. And I think the next transformation in animal welfare needs to be to come to this approach that recognizes this profound importance of human factors in animal welfare. So, some conclusions. First of all, to date, many animal welfare reforms have been modeled after worker welfare legislation that regulated the physical environment and exposure time in factories. But for animal welfare, the same type of environment can produce very different welfare outcomes because of the important human dimension of animal welfare: knowledge and dedication, consistency, skillful handling, positive attitude, treating animals as individuals, creating a culture of animal care, and attending to human well-being. And that shifting to a profession-based model focused on the human dimension is the next step or the next challenge in improving animal welfare. Thank you very much.